Thank you very much for supporting the podcast and engaging with us throughout season 1. And even now, as we are strongly deep into season 2, I'm glad to continue to engage with you. Please feel free to continue to leave comments and to send the DMs that you've been sending, and as well the emails. I'm really excited to hear the feedback and as well the conversation suggestions that you're sending in. Today's topic, I think, is a very meaningful one for us to have. It covers the aspects that we don't normally hear about and we actually are not educated on. And this is both to the normal person on the street as well as to medical professionals. The topic we're covering today is on sexual violence, the forensics angle, as well as what needs to be done for a victim or survivor in terms of immediate medical care. And I think it's such an important topic because you just don't find any information easily available. And in the worst of scenarios where you suffer from violence or an assault, you're not sure of the next steps or what you're supposed to do. So in my usual fashion, I was able to find the expert on these matters because it's so important to talk about gender-based violence, intimate partner violence, all sorts of sexual assault, rape, defilement. You'll forgive me, my voice will crackle. That flu you guys have had running around, you gave it to me. So, but the conversation today primarily will revolve around what you need to know in such scenarios and what the right steps are to take, because we want to empower people to fully understand how to get justice at the end of the road, because it's not just about surviving the assault. If you chose to report it, as you should, and if you are trying to keep yourself as safe as possible, it's important to have the information with you. So today I'm joined by, like I said, an expert in the field, Dr. Kizzie. Is fashionable or is the standard on this podcast. I ask you to introduce yourself and include any shameless plugs.
Thank you so much for having me here today. I'm Dr. Kizzie Shako, as you've correctly said. I'm a forensic medical practitioner. So I'm a doctor who specialized in forensic medicine. Mm-hmm. I have my background, just so that you understand better. I worked in the forensic and pathology services in Ministry of Health for 12 years. Mm-hmm. Dealing with both the dead and the living. Mm-hmm. And then I was posted at the police surgery as a police doctor, right, where the people that I would attend to are living injured persons. Mm-hmm. So I dealt a lot with cases of different kinds of gender-based violence for adults and children. And then now I am an advisor to the Office of the Chief Justice as an SGBV advisor.
Right, okay.
Yeah.
And that sounds like years in a field that can take its toll on anyone, because you're dealing
Yes,
with
definitely.
the really dark side of medical practice. First of all, just to break it down to our audience, what is forensic medicine and what is a forensic specialist?
Okay, so a forensic specialist or forensic medicine is the application of medical practice in legal settings. Mm-hmm. So where there's been a crime that has taken place or a crime that is alleged to have taken place. Mm-hmm. So how does medicine come into this? What can the medical sector provide the justice system with in terms of information and evidence?
Okay.
So a forensic doctor is one who gathers medical evidence for the purposes of criminal matters.
Right.
Yeah.
Okay.
So specifically in clinical forensic medicine, which is the area that I focused on, you're dealing with those who are alive. Mm-hmm. There's lots of fields of forensic medicine. There's forensic pathology, forensic dentistry, clinical forensics, and many others. Mm-hmm. So my area is specifically with living injured people. So those are people who've been injured in traffic collisions. Mm-hmm. You fell off a building and you sustained an injury. You need insurance to come in, or all those sorts of things.
Right.
Sexual offenses, intimate partner violence, where there's been physical assault, child abuse, and so on and so forth. Animal attacks and so on. Okay. So that's basically my area of expertise.
Okay.
Yeah.
So for you, it would be the living injured. I imagine what we know for forensics being from shows like CSI, that's to do with the people who lost their lives.
Yes.
Okay. I think that's a bit clearer for our audience. So I'll go straight into some very grim statistics just so that we have an understanding as to why this conversation is so important. The Kenya Demographic Health Survey gave us statistics this is last year, 2022, that 40.7% of ever partnered women in Kenya have experienced physical and or sexual intimate partner violence in their lifetime. And from the time the survey was being done, 25.5% of these had experienced these forms of violence within the last 12 months. Then we have statistics on men, that it was reported that 6.9% of men between the ages of 15 to 54 have suffered sexual violence at some point in their lives, the highest percentage being those men between the age of 20 to 24 years. Then we have a very sad statistic, which is that only 34% of women who have experienced sexual violence will actually disclose the incident as well as seek treatment. There's a lower numbers where either they will disclose and fail to seek treatment, or they will only seek treatment and choose not to disclose. Mm-hmm. Those are really, really grim statistics. Mm-hmm. In your experience, what stops people from talking about assault or having experienced, especially so cases of sexual violence specifically? What stops people from sharing?
Well, first of all, if we look at the individual who's been abused, right? Mm-hmm. There's a lot of trauma. Mm-hmm. The trauma that they experience is profound. Mm-hmm. There's a lot of shame, mm-hmm. self-blaming, self-questioning, self-doubt. Mm-hmm. So they have to first kind of deal with that, like, what has just happened? Yeah. Did I contribute to this? Mm-hmm. Did I want this? Mm-hmm. Or did I not? Am I confused about this? Mm-hmm. There's also the aspect of even just the injuries that may be sustained. Mm-hmm. Then second, if we look at our society does not really encourage reporting. Mm-hmm. There's a lot of victim blaming, victim shaming. Right. Even your own friends might ask you, really, are you sure you didn't want to engage in that? Or how did you, what were you expecting if you were drunk in a short dress at that party?
Why did you put yourself in that situation?
You asked
in the first
for
place?
it. Right. That's a lot of what happens, and even by service providers. I've heard several survivors talk about being asked such questions at police stations, at medical facilities, being asked, what were you expecting? And that is very off-putting for survivors, and it causes secondary traumatization. And so many times that's what is at play when they're not willing to come forth with it. There's also the lack of knowledge. You'll be surprised how many women, especially in intimate partner settings, don't even understand that what they've just experienced is a violation of their rights.
True.
So when I would see maybe a woman has come to report she's been physically assaulted, she'll talk about the injuries to her head, her different parts of the body, and you have to ask them, was there sexual abuse? And explain what that is, and then the survivor will say, yes, actually I've been sexually abused several times.
I think also it's the narrative that rape is not possible in marriage.
Yes.
If you're married, then there's entitlement to your body, and so whenever your partner or your husband wants sex, then it's his right.
Yes.
So for the longest time, we've had that stigma that I can't call it rape because it was my husband that did it to me.
Exactly.
Right.
In fact, many will say, I don't want to say rape.
Yeah.
But it was by force. Yeah, they don't want to talk about that. It's also a humiliating, very intimate kind of offense that has occurred. And so it's difficult to talk about. It's very difficult to talk about it. Who do you even tell?
True.
Yeah.
True. The next question I have is around basically your experience. Is it easy to report? For those who decide to report, is it easy to make a report and as well to seek care? And what care do people know about? Because that's the biggest question mark we have right now.
Is it easy to report? I don't think it's easy, even if you have the best facilities in the world. Just coming to that point where you decide, I'm going to take this forward, takes a lot of courage and requires a lot of support.
True.
So no, it's not easy to report. But one can either choose to go to the medical facility, and that's not really reporting in terms of a legal report, but it's getting medical care. So if you get to a medical facility, then you should be, the expectation is that you'll receive the medical treatment that you require,
Right.
and evidence should be collected at the same time. Reporting now for a legal response or administrative response by the police requires one to go to the police station. There is no other way to go about that.
Right.
And so one has to go there and report. There's a gender desk at the police stations, which is manned by gender officers who ideally have the information and knowledge required to be able to adequately guide the survivor on what needs to be done, where they need to go, handle them in a trauma-informed manner, and just, continue with the investigations.
Right.
Yeah.
I think there's still quite a bit of confusion as to what is the right way to go about reporting. After experiencing such a traumatic, going through such a traumatic experience, it's understandable that you're confused, you're conflicted. Like we've said, you're not sure, and especially so where it's unknown person to you. So situations where it was at a party with someone unknown to me, or in a relationship and this was my partner, you still have so much that you're grappling with psychologically. But then what is the right next step? Because yes, okay, I've made a decision that I'm going to report the matter, and I want to get the best possible care for my health. What are my first steps? Because I think that's where the confusion starts for a victim or a survivor, is do I go to the police station or do I go to the hospital?
So there's no really set way of, there's no set way as to where one should go to first. Some will go to people around them, like a church, a mosque, the chief, your mother, a friend. But now the next step is what is most critical, and very time must be taken into account. So after an offense has occurred, let's say a sexual offense has occurred, there's been a rape incident. It's important to know that there's been an exchange of bodily fluids and other evidentiary material between the survivor and the perpetrator. And this has to be collected very fast, because every minute after this incident, it's being lost, it's being shed. So hair is being lost, bodily fluids are oozing and leaking, and all that. And so there's also the medical aspect, because we want to ensure that this survivor does not get any infections after this incident has occurred. So for those reasons, it is recommended to go to a medical facility first, so that you can get the psychological first aid that you require, so that the survivor can get medical treatment, and that needs to be done within 72 hours to avoid pregnancy and sexually transmitted infections. Then there's also the gathering of evidence. Now, it's said that there's a 72-hour rule for this as well, but that is not entirely correct. Because evidence can be gathered anytime up to 7 days.
Okay.
Depending on the history of the incident that has occurred. Yeah, and so for those reasons, it's important to get to a medical facility first.
Okay.
And then also remember, not everyone who is violated wants to initiate a police response.
Right.
So why go to the police first? So this means that someone is not decided on whether they want to have this investigated and prosecuted. They can still get the medical care, get the evidence collected, then decide at a later stage whether you want to proceed or not. If evidence is properly collected and preserved, you can do this anytime later on.
Right.
But it's best to do it sooner rather than later, because the criminal justice system is not very open to people who delay in reporting.
Right.
Yeah.
Right.
So
Okay.
after the medical evidence has been gathered, treatment has been provided, a medical report is issued. At government facilities, this would be a post-rape care form. But in other facilities, it could be any medical treatment notes.
Okay.
This is then taken to the police. Then you report to the police for those who want to initiate a police response. The police will then issue an OB number, occurrence book number, some kind of record to show that you have reported an issue, and issue a P3 form, which is also called a Kenya Police Medical Report form.
Okay.
This form needs to be returned to a medical service provider, preferably where you were seen before, where the survivor was seen before. Information is put into the P3 form and then returned to the police.
Okay.
then that will go into the police file and initiate now the investigations.
Okay. Just from the explanation between, especially because we're also speaking to medical providers in the country, it's already confusing for me why we have to fill two different forms. So there's the form, the post-rape form or the PRC form, which it collects the biodata or the information about the patient. It collects the information about the physical examination. It also collects the information about the lab tests that were done on the patient and the samples and that were collected, as well as now for evidence. So all of that is documented, and it gives all that information in one place, one summarized form. And then I also have to wait for the patient to come back and give me a P3 form that gathers the same information again. What's the difference between the two, and why do both have to be filled appropriately?
So that's a good question that many of us have asked. Is there a way we can just merge the two?
It seems like it's something we can streamline, and it's just one that you present both ways.
Exactly. It would seem like the most logical thing to do. But from the explanations that I have received when I've asked several questions and based on observations, the post-rape care form is a Ministry of Health document.
Okay.
So it is available at medical facilities. Even for those who don't want to go to the police.
Okay.
The P3 form is a police document. It's a paralegal document.
Right.
And for the police to function optimally, they must have that P3 form in their police file.
Right.
But there is no law that actually says both forms must be available.
Right.
But in practice, the two forms go hand in hand. They have to both be present. And yes, it does cause a lot of confusion, a lot of fragmentation, because this survivor has to go through so many different service providers just to have these two documents available.
True.
And what happens with that fragmentation is you get time. Time is wasted. Resources are wasted. Evidence is lost.
True.
Many people will, some will give up when they are told, now go to the police, then come back, and then all that. They just give up.
Yeah.
Others will decide, okay, I'll do that next week. And then now more evidence is lost. So it's something that really needs to be thought about very well to ensure that all the services can be provided at one place.
Yeah.
In fact, the police revised the P3 form to make it more, to make it a comprehensive document.
Okay.
It is very, very comprehensive in terms of the information that will be gathered on it. So now they're working on how to disseminate it and rearrange and redistribute resources so that the survivor only has to go through one process.
Yeah. Because I know, even from personal experience of looking after a survivor, where it was confusing because being the doctor in attendance, the primary physician attending to this patient coming in the first time, and of course we know post-rape care is an emergency form of care, you will fill in the PRC form, and then you sign that it's you who did the examination, and you're able to put in, take responsibility for it. And then you go off duty because you are working on a shift schedule. And the patient goes and reports to the police station, comes back with the P3 form, and finds another doctor. Now, of course, this other doctor is hesitant. What do? Do I re-examine the patient and probably even traumatize them further? Do I copy-paste but now sign that because it's me signing? Do I take the responsibility to sign? And at the end of the day, another thing doctors are very skeptical or fearful about is now evidence presentation in court. Then who is responsible? Who is the one who goes to give the evidence? Am I tying myself down by saying, I filled the form, but do I go and say that in court, but I'm not the one who saw the patient? And then this other person. It's very confusing. From your experience, how have such matters been handled?
Well, yes, you're right. It's very confusing, and it's not best practice. The person who examines the survivor is the one who should go to court, ideally, because they did the examination. And now the fact that because what's happening now is that the second the second doctor who is now filling the P3 form is grappling with ethical decisions.
True.
Do I sign and say I examined, or do I examine again?
True.
Which is the lesser evil. So ideally, it should be the first person to go to. The person who examines is the author of that document is the one who should go to court as an expert witness. But unfortunately, that's not what is being done right now. And so many of us within the criminal justice system are pushing for streamlining of these services at one location. For example, placing gender desks at a gender-based violence recovery center.
Right.
Then that's actually all it takes.
Yeah.
There's no hiring new people. There's no building new facilities. It's just about moving existing resources around to ensure that the survivor only goes through this process once.
Yeah.
There's only one examiner. The police also don't have to move around different facilities looking for this evidence. It would make a big difference.
True.
Yeah.
True. Let me turn the conversation to be doctor-facing for a little bit. Now, just talking specifically about what is required. So a patient comes in, they report that they've been assaulted. Has been a sexual assault, and they come in to see me as the doctor on duty, or they've come into my facility or where I'm practicing. What am I supposed to do with this person who's walked in? Just because, again, both of us know there's no formal training in medical school. We don't have an actual course telling you this is step A, step B, step C. This is how to do it in this country. Because again, you're going to have information from other places, but you don't know what is relevant to our country, and especially so now our legal system. So I'm the doctor on duty. A survivor has come in. What is my first step with this individual?
All right. So if you're the medical, physician on duty, what should happen is the usual triaging, because you need to know their status. And then, so this is usually a very long course that I offer. Yeah. But I'll try to summarize
Just a
it.
Summary, yeah.
So it's important to take note of the mental status of this individual and document it. Are they in hysteria? Are they calm? Are they intoxicated? Alert? What's their mental? Just a general mental status assessment, which is part of our medical practice.
True.
It's also important to do a general examination, which is ideally the first step. You look at the survivor, what is it they're wearing, document their clothes, document anything you can see that's outstanding.
If the clothes are torn, if they have injuries that are visible, things like that. Yeah.
Blood-stained, dirty, if they've soiled themselves, any of that needs to be documented in as much detail as possible. Then you move to the body, examination of the body. You want to look for first of all, the person should be covered as much as possible, just to reduce the trauma and shame that they're already experiencing. And you must get a thorough history. History is going to give you 80% of what it is you need to know. Where you're looking, where you're going to look for injuries, where you're going to look for evidence, what you're going to need to do for treatment. So a history must be thorough down to timelines. If someone was at a party, what were they drinking, how much did they drink, things like that. What time, when did they stop, how did they wake up. Just be as detailed as possible and write it down. And then now you look for any injuries on the body. You want to swab areas like where you think there's been a possible bite that has taken place, because that would be a site where a perpetrator left their DNA. And then you want to conduct a genital examination. That comes last. Looking again at injuries, and injury interpretation is a very, very major part of forensic medicine. And again, we are not taught this. It's something that we have to be taught to learn how to describe the state of the hymen, the state of the labia, just the genitals, and know what to do. Then evidence is collected. At that point, whether it's a low vaginal swab, high vaginal swab, depending again on the history. The timelines in the history will tell you where it is you're going to get your swabs from. And then you formulate an opinion at that point. Of course, now, opinion formulation is not something you do at the, you should be able to take your time. It's not something that you should do in a hurry. And that's why when we're in setups where you have 10, 15 cases you're dealing with a day, then chances are you're not going to do a very good job. Which is not the examiner's fault. It's just the situation they found themselves in. So that's basically what happens. Clothes should be packaged. Samples should be packaged properly in a manner that does not allow for degradation of the DNA that is, of the biological evidence that is on the swabs. And there's a way that should be done in our setup.
Okay.
There are jurisdictions where that evidence goes to a lab immediately, a crime lab. But in our setup, that's not possible because only a police officer can take that evidence to a crime lab to maintain chain of custody.
Right.
So here what happens is evidence is placed aside somewhere in some storage facility in the medical center. And you don't know for how long it's going to be there.
Right.
And so preservation is very important. It's also important for our medical sector, medical personnel, to realize that they should not subject that swab or those swabs you collect should not be subjected to any analysis in the lab.
Right.
Any evidentiary swabs.
Right.
So if you need swabs for your medical, take those, but make sure you have the first ones are for the crime lab, because once you tamper with it, then we've lost all the information on it. Yeah, so that's basically it.
Yeah, just to clear that for anyone listening or watching, we are supposed to collect evidence and collect medical samples at the same time.
Yes.
That's the key message. Don't re-traumatize or keep exposing I forgot this, I forgot, I need to do this, oops, I need to come back. And so the advice tends to be, have your setup all ready.
It should be ready
before
beforehand.
You even start with the patient.
Yes.
So once you have your setup, you'll be able to see, I need 2 swabs of this, I need 2 swabs of this, I need urine collection, I need a sample here and a sample here, like that, so that you don't mix it up, and you keep what is evidentiary separate, and then what is going to be used for the medical decision making around the patient's care, you keep that separate as well, and that's what goes to the lab.
Exactly.
Right.
That's perfect. You should be a teacher. Before I forget,
run away.
No, you should be. There's also the national guidelines on the management of sexual violence, and there's a forensic module that was launched last year. I'm not sure if it's online, but
I know that the Kenya national guidelines on management of sexual violence victims is online. It's available for downloading.
Yes,
so for those who,
online.
If you work in a facility that doesn't have protocol on this particular subject or doesn't have the information on hand, you can download that and use it as a reference.
Yes, exactly. That can be done. And then, of course, there are, different, you can approach certain NGOs or CSOs to support a training on the same by forensic experts, because it's so broad.
It's very broad,
you'll be really shocked when you learn just how many things that there are that go into the thought process navigating through a case.
True.
Yeah.
And especially, I think it's so important to have that kind of training, because you're not going to choose the type of doctor who's at the facility.
Yes.
Because a lot of the times it's a general practitioner, or you land in a specialist who isn't, obstetrics gynae like us. So we sort of have the training around what to do during an exam. You will need to have training. It's an added skill we have to get. And unfortunately, since we don't even have the basics from the school side, it's important that if you have, or if you're in a facility and you can advocate for yourselves as providers, reach out to them to support you for the training. That's the main messaging here. Yeah,
that is the main messaging. And if you're even in obs-gynae, really, I hear a lot of things like, it was a nurse who examined, or a clinical officer, or a medical officer, or we need an obs-gynae, or we need a surgeon. At the end of the day, it doesn't really matter. What you need is the training.
True.
Whichever cadre it is, you need to have that training in, even if it's a brief training in forensic medicine, because you also have to understand the medicine ethics, law aspect of what you're doing.
True.
You have to understand how to interpret injuries. You have to understand the forensic science behind it. And so if you can get to do a course, even if it's a graduate diploma, that would really help a lot.
Right, right. Just to add on now on the medical side of things just a bit, mine would be to emphasize that even before you start to look after the patient, we have to always remember we need consent. This person has already been traumatized. This has been such a horrible experience for them. So to suddenly just jump towards them and say, I'm going to touch you now, I'm going to take a sample here, and you're not explaining anything to them, that can end up really, really further traumatizing them. Where possible, psychological support right from the beginning. Have a counselor present with the patient to walk them through all the steps. I think that's such a big important factor that a lot of facilities will miss out on, because they just go straight into the physical. We forget that we need to support this person psychologically as well.
Yeah. It's very important to do that, even so that they are more cooperative.
Yeah, true.
And they are less fearful about what it is you're going to do when it's been explained beforehand. This is what I plan to do.
Yeah.
And even through the process of examination, consent needs to be sought at each step.
Yes, because you are trying to re-empower this person as well. You don't want to imprint that you further. It's something we hear all the time, that I went to the hospital and the doctor didn't explain anything and they just took samples and they touched me again, and I didn't understand what was happening, and this was even more scary then. So I felt like I was abused twice.
Exactly.
And that's the worst kind of imprinting that you can have on someone, because now it's something they can't, delete or erase from their mind, and yet it could have been prevented at that point.
And it's important to remember, if at the medical facility the survivor feels re-victimized, chances of them proceeding to participate in the rest of this process are very low. In fact, it might be killed at that point. So they will not proceed to go to court. They won't proceed with the prosecution.
Yeah.
They won't attend to any court case. So it has a very long-lasting impact, the way we handle.
True. Another thing I think I need to emphasize as well is what to expect once you're in hospital in terms of treatment. So we look at prevention, like you said, of STIs as well as of HIV. A HIV test will be done at that point, and then if it's negative, you will be started on post-exposure prophylaxis. And then we'll also test for pregnancy, and if it's negative, we'll also give you medication to prevent pregnancy from happening. We do see a lot of rape victims who end up pregnant and were not provided the service to begin with. So I think it's important to just enlighten people that is a service that is offered immediately after an assault case. And then we also have, like for the STI prevention, there'll be specific medications that we will issue. And then we also do hepatitis B vaccination as well. And all this is supposed to be part of your care. So if you are in the hospital, it's not just about evidence collection. That's not, in as much as it is as important as anything else for the perpetrator to be brought to justice. Remember, you're still human, and you have to be looked after and look after yourself and prevent any possible preventable long-term physical repercussions or complications coming from this event. So I think it's important for people to understand that, yes, these services are available, and they should be, by the time you're leaving the facility, all this should have been done. It should not be that, oh, nobody ever said anything to me about preventing pregnancy, or I wasn't tested for HIV or offered post-exposure prophylaxis, because those are the stories that we hear.
Yeah.
And unfortunately, by the time someone comes to see, again, you went to a point of care as an emergency. Then later you decide, okay, I have a gynecologist, I'm going to come and see them. By that time, usually the 72-hour window has already lapsed. So it's difficult to fix the gap where we could have done something beforehand. So I just wanted to emphasize that, so that anybody watching or listening has an understanding of what their rights are.
Yeah, it's important to know what to expect. It's good to, sometimes you'll find, I've met like children's officers who will bring survivors who are obviously children, and they say that, I had to but guide the medical person. Sometimes it's not a doctor, it could be any cadre, on what to do and how to go about it, because they didn't really understand what was supposed to be done.
Happen,
or sometimes it's just negligence. There is some level of negligence. And so it's important when survivors know what to do as well. And to remember that this medical part is a two-way approach. It's medical and it's forensic at the same time. And of course, the medical takes precedence over everything else.
True.
Yeah.
And then there's also aftercare. So there's several visits as stipulated in the guidelines that you should have in terms of support and treatment and continued testing, as well as psychological support especially. So all these should be availed to them, and a timeline is issued in terms of your next review should be in X amount of time, the next one is in the next few weeks, like that, so that you have an understanding that this is not a one-stop thing, because we do understand with especially this level of trauma, it's not something we're going to fix in one visit.
Yeah, exactly.
And you need to be offered as much support as possible, and that support is actually stipulated and guidelines are present to direct the providers. So for those who don't know, it's time to get yourself informed, get the training, because ignorance is not an excuse, especially not with something of this magnitude. So the next question I have is around your experience with the next part. So I've gone in, I've had my treatment, I've had the care that I required, we've collected the samples, I've reported to the police, we've filled in all the appropriate documentation. What comes next?
So at the same time, after this medical assessment has been done, and the report has gone back to the police. This is in the event that the survivor agrees to a investigation. The police will initiate investigations. They should go to the crime scene where this happened and conduct a crime scene investigation, which involves collecting evidence, finding witnesses and all that. And then they'll also get information from the medical facility. What should happen is that this investigating officer who is assigned to the case should then go to the medical facility as well and collect the evidence that was gathered and transport it to the government chemist lab. That part should not be done by anyone else, otherwise there'll have been a break in the chain of custody and loss of integrity of the evidence. Then the file, once they are done with the investigations, they'll present the file to the ODPP, the prosecution, who will determine whether there's enough evidence to proceed or not, provide some kind of guidance to the investigating officer. And then the survivor should be informed when their first hearing is going to be. And the next hearing and the next one. And ideally, they should be given as much information as possible about what to expect and what is required of them, which would be to provide their testimony in court. So in Kenya, a survivor is a witness in their own case. Yeah, such offenses are offenses against the state, not quite the individual as such. Yeah.
That sounds traumatic just to think about. Yeah, because to have to then, I've relived it with the doctor, I relived it at the police station, I'm now reliving it again, possibly several times over in the court system.
Yes, it can be a bit daunting and intimidating.
Yeah. You can't even put any judgment on anyone who decides not to go through with the whole process.
Yeah, and even those who do want to do that, they are just finding these movements are a bit too much. And there's no support, there's no financial support, and there are very many survivors who can't. That's just not a priority. My priority is to feed my family. So that's where my funds will go, and they're not going to proceed with it anymore. And so in the criminal justice system, there are reforms on going to make this a less painful process, make it less, this need for movement to be removed so that it's no longer a barrier to access to justice. And that's what's happening now at the different institutions. For example, I believe the prosecution is working on getting pre-recorded testimony so that a testimony is recorded once and then all the other actors use that information. I don't know how far that's gone yet, but it is ongoing. At the judiciary is working on virtual courts, making it more friendly for SGBV survivors and children as well.
In cases, I like that you mentioned children because that would be the next area to discuss. In cases that involve children, what needs to happen? Because sometimes, and especially so unfortunately in a lot of our communities, the perpetrator tends to be a family member, sometimes a parent who should be the protector of that child. What happens in such a scenario? Who looks out for the child, or who is in charge of making sure this child goes through all these steps that we've talked about?
With children, first of all, with children, now with the new Children's Act of 2022, reporting is mandatory. So every person who encounters a child who has been abused or maltreated is required to report it to authorities, which means if a child is presented to you as a physician in a medical facility and you suspect abuse or maltreatment, you are required to inform the authorities. And so you can call the children's office. They're the ones who would be able to come on board and ensure that this child is safe and secure, and look for a shelter, a safe space, work with the investigators, make sure that the perpetrators are kept away from the child completely. Of course, it's a lot harder than it sounds, because even getting safe spaces is very difficult. We don't have enough. But basically, you need to have your children's service on speed dial if you're in a medical facility, because most victims are children.
True.
A large majority of victims are children. I would see out of 10 cases, I would see eight would be children, and or more would be children, and then maybe one adult or two adults a week. The rest would be kids. Yeah.
Right. At this point, I want to turn to you personally now, because, like I said, you've been in an area in medicine, so where I tell people I practice happy medicine, because my side of medicine is mostly bringing new life into the world and sharing good times with the families. For your side and forensics, it tends to be the darker side, like dealing with people or helping people at the darkest times of their lives or after such a traumatic event. How do you look after yourself? How do you protect your own mental health during this practice?
Oh gosh. Well, yeah, it's a field where you see like the worst side of humanity, especially when you're interacting with perpetrators, because many of them actually have told me what they did and how they did it.
Okay, wow.
Yeah, which can be really
Okay.
shocking.
Yeah,
And
yeah.
you have to carry all this home. But I think even dealing with survivors and their shame, the shame they carry on them, is what is most profound and very, very heavy on us as examiners.
True.
But unfortunately for me, I didn't know about vicarious trauma until it was very late, and I had already begun to have some symptoms here and there of feeling stressed, depression, wondering what's happening, not understanding why I feel off all the time,
yeah.
why I'm getting angry. But so I took measures to try and reverse that. So one of them was to get away from dealing with patients and suspects every day. And just dealing with court work, because of course if you're seeing 15 what we would call special cases in a day, so that's your rape, defilement, murder, murderers or murder suspects, rape suspects in one day. That's how many in a week. So in a month you have hundreds of cases.
Yeah.
And you're also dealing with other cases as well that are non-sexual. And so I just distanced myself from dealing with cases hands-on and tried to clear my court backlog, because I was even getting arrested by the courts for not attending court. Yes.
Okay, right.
Yeah.
Okay.
So I did that, which helped a lot. You must get debriefed. It's very important to get debriefed regularly. You can find a psychologist, preferably a trauma therapist, not just any.
Not just any.
Yeah, a trauma therapist or a clinical psychologist who has dealt with such cases for a long time, and agree on a way to debrief or get supervision regularly, if it's every 4 weeks, every month, every quarter.
Right.
But just make sure you have time for that. Eat healthy, sleep enough, and when you be aware of the signs of secondary trauma, because then you can address it earlier.
True.
Yeah, and it's also important for those of us who run institutions or certain departments to ensure that the examiners have a supportive environment, a support framework within the institution, so that they are able to come forward when they are feeling they need time off, or a support system that allows them to work in, let's say I work 1 year, then I take a year off, or I work 3 months, I take 3 weeks off.
Through different departments as
exactly,
well.
just so that you're not carrying this burden on your own for a very long time. And of course, exercise, which I'm still learning how to do. I'm not so good in it. But and spending a lot of time doing things that you love. So if it's listening to music, if it's cooking, hanging out with friends, it needs to be maintained. Sometimes you don't feel like, but you have to push yourself to do the things that you love. Otherwise, you go into isolation. Yeah, you have to be very intentional.
I think it's so important that we have that angle. We have to look at it, because the second victim, which is us, the providers, is completely overlooked when it comes to a lot of the types of work and types of situations that we have to deal with. And then you end up taking it out on the next, or lashing out, or completely burning out, breaking down, psychological. Like we take it for granted that you're psychologically sound minded. So I like that you have taken steps proactively to protect yourself and look after yourself in those scenarios. As we wind down, maybe just to look at in your opinion, what do you think are the biggest gaps we have in this area when we're managing GBV, IPV, and just sexual violence in general? What do you think are gaps that you have seen while working in the space, and that maybe we should be looking towards? And this is in general, from the practitioners level all the way through the court systems and everything. What gaps have stood out for you, and what do you think we can do better?
I think the first gap for me, that's the most obvious, because where I worked, I would see things from a bird's eye view, because I would interact with all the different sectors. I would interact with the medical reports. I would interact with the medical personnel, the victims, the suspects, their families, defense counsel, prosecutors, magistrates, judges, and the community, and those who have even been found guilty and are convicted. I think one of the most striking gaps is the knowledge gap, which we have already discussed. I think the different dynamics of gender-based violence, child abuse, and the critical role of forensic evidence needs to be taught at all levels, not just the medical, but also the police, the prosecutors, all these different...
And probably even the family, the society in general, so that you know how to support a survivor.
Yes, exactly. So that I think is the biggest thing. Also knowing where to go and what to do. Over 10 years, we still get calls, I don't know what to do. My friend has been raped, my child was defiled.
True.
And I'm just wondering, how is it we can get this information to everyone, so that they are not going through this lost, confused period, and then a lot of time is wasted, and information is lost. So a knowledge gaps is the first. I think once we have that, a lot of these other things will disappear. Then we have the infrastructural barriers, where you have this, you have to go to this office, that office, get this person, there's no legal aid.
Or from one hospital to the next, and then this form is not here, but go to this person, or specific people, especially places where it's tied to a person. Those I think are even the worst. Or this one is not in the office today, you need to come back tomorrow, their shift is at night.
Exactly. It's really, I think we just need to move away from that and begin to embrace an actual one-stop center. We can do this because, as I've said, you won't have to hire people per se. I was at the police surgery on secondment, and so was everyone else in there, which means that these are resources that already exist. So I believe this is truly doable. The other gap is the societal barriers, where we discussed the victim shaming, victim blaming. I think once people understand the dynamics of how these issues occur, they might be more compassionate to those who are suffering from these kinds of violations. Then fourth is the number of players we have in the SGBV ecosystem. There's just too many and different actors, completely
isolated from everyone else.
Exactly, in a siloed manner. So the police are doing something. Ministry of Gender has developed gender-based violence recovery center guidelines. The police have developed polycare. The Ministry of Health has the national guidelines on management of sexual violence. Then you have different others are doing different things as well, and not speaking to each other. And we also have a very development partner-driven environment. So we should be a state that says, this is what we need to do. This is how we are going to do it in this phased approach. Now, the others, CSOs, development partners, plug in from there, not the other way around. I think those are the biggest issues that I have observed. And I think we really need to have an SGBV coordination body that can coordinate, regulate, and provide some kind of supervision over the different actors in the country. Because that way we'll be able to know what's happening in Bungoma, in Mombasa, in Nairobi, and provide guidance. We have another problem where you have the police in different counties, for example, will all say, we were trained in GBV, we were trained in GBV. So there are so many different trainers training on different things, and no one has an idea about the content, what is being trained, what's the curriculum. So we need to streamline and harmonize all the training content across the different sectors.
Right.
Yeah.
Okay. Fantastic advice. I'm hoping someone somewhere can help us pick up from there.
I know.
Then finally, and this one now, I'm going to plug into learnings from exposure to perpetrators and having conversations with them and hearing their stories, and the fact that you've said they come so openly and tell you what they did. Is there any advice you can give us on how best to keep ourselves safe? It's a tough one.
Very tough one, because I'm like, okay, first, perpetrators should stop abusing.
There's that. Simple. By the way, if we could just
that's it.
that would be the end of this conversation. We would not even have anything to talk about.
Exactly.
Right.
But that starts with one of the things I picked up when I was, because I would have to not interview, but examine suspects. One of the things we must do is also examine suspects so that you have information on the suspect and the victim as well.
Right.
And something that came out very clearly is that many of them suffered childhood trauma. A lot of them were victims of abuse as well.
Right.
And so I was actually very compassionate, and I would feel sorry for them, because I'm like, oh, you must be a product of your environment. And so what we need to do as a preventive measure is begin to ensure that our children grow up in optimal environments, which are not exposing them to violence, to abuse, to these kinds of stressors that are very unhealthy for children, and that promote adverse childhood experiences. I think that would go a long way in reducing the number of perpetrators we would have out there. But other than that, and other than perpetrators not violating, it would be good to equip yourself with information and knowledge, what to do, where to go. Self-defense.
Which is such a horrible thing to say to someone.
Yeah, it is.
Because you are female, or because you are
terrible.
a child, you can't be here at this time dressed like this, doing this. It's horrible, but that's our reality, sadly.
Yes, I really struggle to give that kind of advice, because I'm like, it's not your fault,
exactly.
but it is what it is. So self-defense is also a very good, self-defense techniques is something that I think all women should learn, and children. First of all, it's fun. It boosts your confidence, and it will give you the techniques to fight someone off and to know when you're in danger.
Right.
You will immediately be able to assess a situation where you need to exit immediately.
True.
Then you don't even have to end up engaging in any kind of conflict.
Okay. So for me, it's just to say thank you so much, Daktari, for joining me today, because I think this is a conversation that we have not been having. Again, I do a lot of research before hosting conversations on the podcast, and just finding data. We had this conversation before we started the shoot. Finding data, the relevant data that surrounds and gives us information about what needs to be addressed is almost impossible. And I think it's also a product of the fact that everything is decentralized. We don't have access to the same information outside of, resources like KDHS, for example. But I think we do have lots of room for improvement. And if we can get the right players and get people to come to talk to us on the ground first, because we tend to like to fix things from cushy places up in the castle. I prefer that people start to get proactive and come and find out what are the limitations, where is it that laws are not able to be implemented, what is the hindrance, especially because only 34% of women reporting that they've been violated is not acceptable. And yet we know that the numbers of victims and survivors is astronomical, especially post-COVID. The increase was quite shocking.
Yeah, the shadow pandemic.
Yeah. So thank you so much for joining me during this conversation. I'd like to say thank you to the audience for tuning in, listening in, watching. I'm looking forward to having continued conversation. If there is interest, I'll have Daktari join me on a live session. So please plug in and let us know so that we can do this on social media as well and just answer any of the questions that may come up from this episode. I'd like to say thank you. Find all our information in the description box below. I'll include Daktari's as well. And on all the social media pages, I'll include all the links in the description as usual. Thank you so much for listening in, for tuning in, for watching, and I look forward to seeing you again next week.